Hello friends, today let's study about infant jaundice, that is also called as neonatal jaundice. Infant jaundice is yellow discoloration of a newborn baby's skin and eyes. Infant jaundice occurs because the baby's blood contains an excess of bilirubin, a yellow pigment of red blood cells. Infant jaundice is a common condition, particularly in babies born before 38 weeks gestation, that is preterm babies, and some breastfed babies. Infant jaundice usually occurs because a baby liver isn't mature enough to get rid of bilirubin in the bloodstream. In some babies, an underlying disease may cause infant jaundice. Causes: excess bilirubin is the main cause of jaundice. Bilirubin, which is responsible for the yellow color of jaundice, is a normal part of pigment released from the breakdown of used red blood cells. Newborns produces more bilirubin than adults do because of greater production and faster breakdown of red blood cells in the first few days of life. Normally, the liver filters bilirubin from the bloodstream and releases it into the intestinal tract. A newborn's immature liver often can't remove bilirubin quickly enough, causing an excess of bilirubin. Jaundice due to this normal newborn condition is called physiologic jaundice, and it typically appears on the second-third day of life. Other causes: an underlying disorder may cause infant jaundice. In these cases, jaundice often appears much earlier or much later than does the more common form of infant jaundice. Disease or condition that can cause jaundice include internal bleeding, that is hemorrhage, an infection in your baby's blood, that is sepsis, other viral or bacterial infection, an incompatibility between the mother's blood and baby's blood, a liver malfunction. Symptoms: yellowing of skin and whites of the eye. The main sign of infant jaundice usually appears between second and fourth day after birth. To check for infant jaundice, press gently on your baby's forehead or nose. If the skin looks yellow where you pressed, it's likely your baby has mild jaundice. If your baby doesn't have jaundice, the skin color should simply look slightly lighter than its normal color for a moment. Examine your baby in good lighting condition, preferably in natural daylight. Complications: high level of bilirubin that causes severe jaundice can result in serious complication if not treated, that is acute bilirubin encephalopathy or kernicterus. Diagnosis: your doctor will likely diagnose infant jaundice on the basis of your baby's appearance. However, it's still necessary to measure the level of bilirubin in your baby's blood. The level of bilirubin will determine the course of treatment. Tests to detect jaundice and measure bilirubin include a physical exam, a laboratory test of a sample of your baby's blood, a skin test with a device called trans- transcutaneous bilirubinometer, which measures the reflection of a special light shown through the skin. Your doctor may order additional blood test or urine test if there's evidence that your baby jaundice is caused by underlying disorder. Treatment: mild infant jaundice often disappears on its own within 2 or 3 weeks. For moderate or severe jaundice, your baby may need to stay longer in newborn nursery, so be readmitted to the hospital. Treatment to lower the level of bilirubin in your baby's blood may include enhanced nutrition. To prevent weight loss, your doctor may recommend more frequent feeding or supplementation to ensure that your baby receives adequate nutrition. Light therapy, that is phototherapy. Your baby may be placed under a special lamp that emits light in blue-green spectrum. The light changes the shape and structure of bilirubin molecule in such a way that they can be excreted in both urine and stool. During treatment, your baby will wear only a diaper and protective eye patches. Light therapy may be supplemented with the use of a light-emitting pad or mattress. Intravenous immunoglobulin. Jaundice may be related to blood type differences between mother and baby. This condition results in the baby carrying antibodies from the mother that contribute to the rapid breakdown of the baby's red blood cells. Intravenous transfusion of immunoglobulin, a blood protein that can reduce level of antibiotics, may decrease jaundice and lesion the need for exchange transfusion, although results are not. Conclusion. Exchange transfusion. Rarely, when severe jaundice doesn't respond to other treatment, a baby may need an exchange transfusion of a blood. This involves repeatedly withdrawing small amount of blood and replacing it with donor blood, thereby diluting the bilirubin and maternal antibodies, a producer that performed in a newborn intensive care unit. Thank you.